Hi, everybody. I'm Chris Flanagan. Welcome to What's Going Around. Each week, we speak with doctors all around the DMV and the region about what's going around, what they're seeing in their practice. And right now, of course, the cold weather, these bitter cold temps atop of all our mind. We're joined now by Dr. Taryn Travis, a surgeon at the Burn Center of MedStar Washington Hospital Center, to talk about frostbite this week. Dr. Travis, great to see you. Thanks for joining us.
Thanks for having me, Chris.
Yeah, you bet. All right, so with these temperatures we're seeing this week, I mean, just a bitter, bitter cold. How concerning is this for you?
Very concerning. Frostbite is at a peak for us right now with the coldest temperatures we've had so far this year. We've had several patients admitted, and these can be really debilitating injuries if they're not taken care of quickly and properly.
Dr. Travis, what are some of the signs and symptoms of frostbite? What should we be looking out for?
The biggest thing that we want people to pay attention to is numbness and tingling of exposed areas. That's usually your body telling you it is time to get warm. It doesn't necessarily mean that you have long-lasting tissue damage yet, but that's the road you're headed down if you don't warm up exposed body parts.
And Dr. Travis, how long is it before frostbite sets in on somebody who's been outside?
So it's a combination of the air temperature and the wind speed that really determines how long someone can be outside before being at risk for true frostbite and tissue damage. With air temperatures and wind speeds we're seeing like today, you're looking at about an hour probably of being exposed to these colds and wind speeds before you're looking at true tissue damage. Those things get worse if you are in wet clothing or if your core body temperature is cold. So if your core body temperature is low because you're not in proper clothing or you've been exposed to the cold for a long time, your body's going to divert blood flow away from things like fingers and toes and the tips of your nose. So this problem is just going to snowball the longer you're exposed to the cold.
Dr. Travis, if somebody does come down with frostbite, can it be treated at home? Can we treat ourselves initially with frostbite?
So minor frostbite, which technically isn't frostbite, it's frost nip. Minor frost nip can be treated at home, and this is best done with rewarming first your core body. Of course, you want to make sure that your core temperature is warm because that can lead to cardiac problems and even death. But if your core body is warm and you have frostbite, for instance, of your fingers, the best way to treat that at home is to rewarm these things in warm water. We don't want it to be hot water because if you expose frostbitten tissue to hot water, then you're going to create more damage. But rewarming in warm water that you can tolerate is the best way to warm yourself. Now, if you see color changes, swelling, or blistering, those are more significant signs, and those need to come to the hospital. Burn centers are especially equipped to deal with this, but any healthcare provider is the best thing for you to do if you're not near a burn center.
If someone does have frostbite and takes themselves, does go to the hospital, how do surgeons, at MedStar Washington Hospital Center, how do you treat a patient with frostbite at the burn center?
Depends a little bit on how long it takes for you to get to us. The most sophisticated ways that we can help with frostbite really have a defined window in which they're possible. They're best delivered in the first 24 hours after injury, but aggressive burn centers that are used to seeing this will try to treat people even out to 48 hours. And these particular treatments target small blood vessel clots that happen when we're exposed to cold injury. If you present to us outside of that 48-hour window, which many people do, unfortunately, there's less that we can do. And so then we're talking about wound care, keeping things from getting infected, and ultimately some people require amputations if their tissue damage is bad enough.
Are there cases where patients with frostbite, it's reversible, maybe not as severe cases?
Tissue damage from frostbite can be salvaged if you present quickly. And so this is why, we're so glad to be talking about this with you, because educating people on how to get to care is very important. You have that very defined window in which we can do those things and save tissue for people. And there's good evidence that if you intervene quickly, we can salvage digits, feet, hands, those sorts of things. It's also really important for patients to remember that when you are rewarming after frostbite, everyone wants to do this. Do not rub affected areas, because that tissue damage with additional compression and friction can actually worsen things. So rewarm with water, get to care, and if you can do that as quickly as possible, we can often save tissue.
Oh, great advice there. And Dr. Travis, what are some basic, simple ways that we can all prevent frostbite if we have to be outside in this bitter cold weather?
Yeah, good question. So dress in layers. Cotton is not super helpful if it gets wet, so remember to bring dry things along with you if you think that you are going to be in a snowball fight, for instance. Those clothes are going to be wet once you're done with that. So you need dry things that you can layer on top to trap that air in. We know that mittens keep fingers warm a little bit better than fingered gloves do, so you have access to that. That's great. The other thing that's really important is when we have cold weather like this and potential snow, keeping warm, dry stuff in your car. We all remember a few years ago when there was that big snowstorm around here and people were stuck on the 95 in their cars for a long time. You've got to bring things with you in case you get stuck somewhere so that we don't have frostbite or even worse, true hypothermia.
Yeah, some great information. Dr. Travis, this week especially, the bitter cold temperatures here in the D.C. and so many people coming from all around the country being outside for hours at a time. Really great information. Really appreciate you taking a few minutes and speaking with us today. Thank you very much.
Absolutely. Thanks for having me.
Yeah, you bet. Thank you.